everyone. I'm Dr. Meredith Langhorst, and welcome to our live OrthoIndy Facebook event. We're going to give it a few seconds here just to get everybody joining in and logging on, and then we'll get started. So I am in the Spinal Diagnostics and Therapeutics Division here at OrthoIndy. I've been with OrthoIndy for almost about 14 years now, and I really focus on the non-operative treatments for management of back and neck pain, minimally invasive spine procedures. I focus a lot on therapy and exercise-based treatment. I have an extensive amount of clinical experience in that area, do a fair amount of sports medicine and some regenerative medicine as well. So take care of patients from adolescents all the way up to the aging population in every realm. So tonight we're going to really focus on looking at posture, how that affects your back pain, and specifically also in kind of your workplace environment, really focusing on some ergonomics and things that might be able to help you moving forward. So also just to note, after I'm done discussing this topic here tonight, we will have some time for questions. First, we're going to be going to some previously submitted questions that I'll answer, and then if we have some time left, we'll go to some questions in the comment section as well. So just so you know, about 80% of the population has back pain at some point in their lives, most of it turning chronic, lasting anywhere from 6 to 12 weeks, which is why I'm so busy in my practice. Majority of the patients that have back pain are actually non-surgical. Most of it is musculoskeletal, and believe it or not, most commonly a lot of it is really due to poor posture, core weakness, lumbar strains, workplace environment, ergonomic issues. That's the majority of our back and neck pain that we treat. So most of us spend at least 8 hours a day, many days of the week, at our workplace, even starting as young as our children, right? In their workplace, it's school for them. They sit most of their day. They've got these really large backpacks these days that they're carrying multiple books in. Some of them have to walk after they park their cars a mile into school with these heavy backpacks, and they walk in a forward flex posture, and then they go sit all day in poorly designed desks and chairs. And then of course, these days especially, many of them are on their smartphones for multiple hours in poor positions, and they're slouched and their heads are forward, and it's just kind of a perfect setup to have back pain later in life. So it's really important that we even look back into our children and help them maybe with some information from this video tonight, how to change their workplace and to prevent back pain for them in the future. Really, a lot of us should not be in the same static position for more than 20 minutes. There's significant stress on the tissues that occurs after that point that can turn into injury. So, adults, right? I mean, a lot of us have sitting jobs, so we sit much throughout the day. We work at our computers, and maybe we don't have properly ergonomically designed chairs or desks or workstations, and we might even be on our phones for multiple hours along the day as well. And that sitting position can create significantly tight hip flexors. Hip flexors are really important muscles that attach from our spine down to our thigh bone. And what happens is when they become tight, when we sit all day, they cause kind of chronic spinal compression in our lower back, and that contributes directly to back pain as well. But it also causes our lower abdominal core muscles to become weak and not allowed to be activated properly, and that in turn also causes gluteal weakness, which is kind of our buttock muscles. Those are really important in core strength. And when we have tight hip flexors, it changes the position of our pelvis, and it shuts all of those important muscles off, and we have back pain. Also, if you're using your computer, or again, like I said earlier, a phone, a mouse, typically not all of us are ambidextrous, right? So we use one side of our bodies more than the other. And that can create side-to-side imbalances as well. Sometimes our oblique muscles, our side core muscles will become tight in one position, and then we become off balance that way too, which can create further issues with back and neck pain. Many times once we have this pain that started, now we'll start to slouch in alternate postures to try to get away from that pain, and that just creates in turn more issues. So many patients that have low back pain that will come and say, not only I have low back pain, but I'm getting all of this mid back pain. And that's because their whole posture has changed to kind of work around that low back pain that they're having. So what's the answer for all of this? Well, a couple things that we'll talk about tonight. Big thing I'm a proponent of is standing adjustable desks. I feel like I write for this many times throughout my day for patients to bring to their HR department, or just to educate them on standing adjustable desks. This way you can sit for a certain amount of time and you can stand for certain periods of time. Ultimately, I recommend changing that every 20 minutes would be ideal, but 30 minutes might be more practical. And maybe you have to set an alarm to remind yourself, but those are really nice things to have. I wish we had them in our classrooms too for our students. Also, maybe having a headset for your phone instead of using the phone in one ear. That could help shoulder pain and neck pain. Maybe even having a professional ergonomic evaluation of your workstation. Some companies offer this, especially if it's with a doctor's prescription for some individuals, and they'll come in and they'll set up your workstation that will fit your height, your body type, your mobility issues, and that might be really helpful as well. We want to make sure that we look at the type of chair we're sitting in if we sit all day. So proper lumbar support in our chair, the way we sit in that chair, and sometimes we have to look for an alternate type of chair to use. So sometimes I'll recommend an actual stability ball. These are big exercise balls that you might have seen before. They kind of have a little bit of bounce to them, and if you sit on them, you have to naturally engage your core, your pelvic floor muscles, which is really important for us females. We have to engage those pelvic floor muscles and our core to support our spine, and it puts you in natural spinal alignment, because if you're not, you'll fall off. So I like that. So a little core work with proper sitting, stability ball for your chair. Or sometimes we can use a kneeling chair, and that's where basically you kind of sit forward on your knees. It is padded there as well so that it takes the pressure off your knees, but again, it puts you in some natural spinal alignment. So those are things to look at. Really also the biggest thing too is combating that prolonged sitting position with exercise. So stretching, right? Hip flexor stretching is really important. Hip mobility is really important. Also working on engaging the lower abdominal core muscles and the gluteal muscles as well. I like to, of course, get up and walk. I mean, that's what we always recommend, but I also like wall stands. So you get up, you go find an empty wall, you put your heels against the wall, your calves, your buttocks, your shoulder blades against the wall, you put the back of your head against the wall, you reach your fingers down towards your toes, and you try to put your shoulder blades in your back pocket, and you hold and you press into the wall for maybe about 20 seconds. Try that 5 times. Try to expand on that. The problem is all day long, whether we're in the sitting position or sometimes the standing position, which we'll talk about here in a minute, everything that we do is in the front of our body. And so we get really tight in the front side of our body, and the back side of our body doesn't get engaged, and that creates imbalances and pain. So we really want to focus on exercising the muscles on the back side or the posterior side of our bodies. So another type of workplace that we might run into or see is repetitive overuse injuries with people that do heavy manual labor or factory type work. Maybe they work on a line and they do the same exact repetitive movement all day long with limited break time. That increased wear and tear on the tissues makes us very vulnerable to injury and to pain. It also creates biomechanical forces and stress on our tissues, and oftentimes that'll cause worsening posture imbalances, and that also creates more pain. Poor standing posture, so if we don't stand well to begin with, if our pelvis is rotated, sometimes people tend to lock out their knees when they stand, which causes their pelvis to rotate forward, which doesn't allow us to activate our core. Our glutes don't activate. Sometimes it makes our shoulders tight and it creates back pain. So you can kind of see a common theme going on here. Same thing. What's the treatment? Of course, proper exercise, really stretching the hip flexors, making sure that our pelvis is underneath us and that we keep proper alignment. Again, hip mobility. You might think just because you work heavy manual labor all day, I've done my exercise for the day, I don't need to do anymore. It's actually not true. That heavy repetitive stress, load, manual labor, that creates increased stress to our tissue. So we need exercise to combat that and repair the tissue. So standing posture is really important as well. We really want to make sure that our chest is out, our head is back and kind of over our center of gravity. Really want to avoid that forward head posture. So we really want to keep working our muscles to bring that back. We want to make sure our shoulders are directly over our pelvis. We want to make sure that our feet are slightly apart and our knees are subtly bent. We want to take our belly button and bring it into our spine. That activates our lower core muscles and helps rotate our pelvis under. We want to tuck in our buttocks and tighten our glutes. And we want to be able to draw a straight line from our earlobe down to our shoulder, from our shoulder down to our hip, hip down to our knee, down to the middle of our ankle. And you can look at that. Maybe even have someone take a picture of you, friend or family member, as you're trying to do that, so that you can say, oh yes, I see that, that's the proper position. Now you know how to engage that on your own. Nice thing for people that stand a lot throughout their day too is maybe like a rubber ergonomic cushion mat that help absorb some of that pressure and stress. Also maybe putting one foot up on a ledge or a box so you can have one knee bent. That helps kind of rotate that pelvis for us to take some of that pressure off the low back. Of course, make sure your environment's safe for that. We don't want any trips or falls. And again, change position every 20 minutes. I do tell my people that have a lot of back pain when they stand in the kitchen cooking, maybe open up a cabinet door and you can put your foot inside the cabinet. Again, be mindful you're doing that. We don't want you to turn quickly and fall over your cabinet door. Sitting posture. Make sure that your knees are level with your hips. Use lumbar support in your seats, in your cars, if you drive for work all day long, right? Really make sure, have someone help you, maybe even a physical therapist. We've ordered that, physical therapy to help set you up in the proper position in your car. Make sure you have your lumbar support there. A lot of times I'll recommend go to the store and buy a very inexpensive pool noodle. Those are the things you see kids swimming around floating within pools. You can actually cut them to the size of your chair or your back, and you can use that for lumbar support. You can put it in your bag, you can use it at work, at your desk, you can take it in your car, on an airplane. I've used it personally. Great way to have lumbar support wherever you are. The other thing I wanted to mention too, when you lift, if you do a lot of lifting for work, make sure you try to avoid combined lifting and rotation at the same time. If you have a heavy object on one side, turn your entire body to that side, use proper lifting technique, rotate your entire body back to where you want to place that item, and then place the item down. Okay, so I think that was hopefully a good summary for this live event for all of you, for maybe some things that you might be seeing and how to change your posture and help your back pain. If you yourself or someone you know is looking for some relief of your back pain, then I think we have a link here on our website that you can request an appointment. Happy to answer any questions. We are going to go over right now to some questions that we've had previously submitted. I'm going to review those and answer those, and then again, like I said, if we have some time, we'll look into other comments later. So here we have the first question we have from Michael. Can you tell me how a diagnostic ablation test is done and how it's monitored to see if it's effective in order to do a longer lasting block? So what Michael's talking about here is a procedure called radiofrequency ablation, or maybe some people have heard of it as rhizotomy or a burning of the nerves, and we do that for back pain and neck pain. And that's specifically done to treat pain that's typically coming from a portion of the spine called our facet joints. Sometimes they become arthritic, or we have stress in those joints and they produce pain. And oftentimes we'll do some standard injections to try to help that pain, and if we're unsuccessful and we think that patient might be a candidate for an ablation procedure, first we'll actually do a diagnostic block. So the block actually comes first, and it's of these small little sensory nerves that go to those joints, and we basically put some numbing medicine on those nerves, and we put them to sleep essentially. And then what we do is we have you kind of mimic some things that might reproduce your pain within 6 hours of having that procedure. And we have you rate your pain hourly for the rest of that day. We capture those pain scores. So we want you to actually go home and stand for maybe a prolonged period of time, do your laundry, whatever might reproduce some of your symptoms, do some of those activities and rate your pain. We'll do that for the entire day, and then usually we'll talk the day after to see how that's changed your symptoms. And if you get a really good response for that diagnostic block, then you might be a candidate for that nerve ablation procedure in the future. So I also have a question that kind of talks similar to that topic from Christine. She asks, what has been your experience in how long a patient reports pain relief from that nerve ablation or rhizotomy type procedure, and how often can they be repeated? So if you look at all the literature, you look at probably about 6 months to 2 years of pain relief from that nerve ablation procedure. I find with an average of about 9 to 12 months. Yes, those procedures can be repeated. They can be repeated no sooner than 6 months, but after 6 months, they can be repeated, and they can be repeated indefinitely moving forward. So those are the questions that we had tonight on that nerve ablation procedure. So next I have a question from Mackenzie. What are your best tips to help take stress off your spine or back when you sit in a chair for most of your day at work? That was question A, and then question B part was, if standing at your workplace while you work is an option, what is the average amount of time you recommend people to stand in order to take stress off their back? So I think that was a great question, and maybe we should have asked Mackenzie's question before I ever started my discussion tonight, because I think what we talked about tonight answers her question directly. The biggest take-home message is get up, move, stand, stretch your hip flexors, exercise your core muscles, and I would say try to avoid the same or static position for 20, at least 30 minutes, and then I would change. Okay, so the next question I have is from Casey. Casey has a great question. She says, I'm a side sleeper. However, when I wake up in the morning, my back hurts. It's only in the morning, and is that from how I'm sleeping? Yes, sleeping positions can also, is another form of posture, not in the workplace, but when we're sleeping, that also can contribute to back and neck pain. Sometimes, of course, the mattress that we have also can contribute to our back pain as well, or neck pain. But if we lay in one position that's not proper posture or normal spinal alignment, that can create extra stress to our spine and create pain, especially in our pelvis as well. There's a joint between our spine and our pelvis that if is anatomically put in a stressful loaded situation for prolonged periods of time or static and not moving, also can create pain. So if you are a side sleeper and that's really only the best way that you can sleep, I usually recommend putting a pillow between your knees, and that'll help keep your pelvis a little bit more level throughout the night. Ultimately, what I recommend though is trying to sleep on your back with a pillow underneath your knees, and that'll keep you in the best spinal alignment that there is, with a neck pillow as well. Sometimes they make special cervical pillows to put you in the proper position if you have neck pain. Another thing that's worth trying is maybe some stretching before you go to bed, and stretching even before you get out of bed in the morning. Okay, then I have another question from Ashley. Ashley, is there an exercise program you recommend over another exercise program that is best for strengthening your back? For example, Pilates, yoga, or bar. That's part A, and then part B. Well, actually, let's just start on part A, and then we'll. So, exercise in general is great. Sometimes it's very specific to each individual. There's certain forms of exercise that people find more helpful. I think Pilates and I think yoga are great forms of exercise. I think Pilates is great for core stabilization. There's a large part of the population that has back pain because of core weakness or kind of instability, if you would, in the pelvis. A lot of laxity in the pelvis, really common for women of childbearing age. Every month with hormone cycles, our pelvis contracts and relax, and that can create some instability in our pelvis. And then, of course, women that have had multiple children will have some laxity in our pelvis as well. And so we need stability. We don't necessarily want to stretch anymore because we can sometimes overstretch the muscles and the ligaments. We need stability. So in those scenarios, sometimes I might be more inclined to recommend a Pilates-based treatment with gentle exercise. Other individuals who sit for most of their day, who have repetitive stress loads where they get really tight and stiff, might benefit from some maybe more increased stretching, where they might do some more advanced yoga. I think yoga is great in general for the meditative breath. I think the breath of yoga is really important to proper spinal mechanics. It helps to naturally decompress and compress our spine, kind of like an accordion. It helps to use our diaphragm properly, and that actually helps with back pain. So yoga breathing in general for everybody is a great practice to learn. Now, part B. My mom has back pain but refuses to see a physician for it. Come see me. And doesn't like to pay for just physical therapy. Is there a workout plan you can recommend or foods that can help straighten her back? She's 51 years old. So, technology is an amazing thing. YouTube is amazing. There is extensive amount of research out there and free videos on great ways for mat Pilates that you can do exercise on your own at home. So I would check out those websites, and I think that might be helpful. Happy to see her if she has any other questions. So I think we've had some great questions tonight, and it's been a great event, and I really appreciate you all coming out. If you have any further questions, please feel free to reach out to us anytime on our Facebook link, on our webpage app, request an appointment, and we'd be happy to see you. Have a great night.